we come to the very last part of our conference. Thank you to our speakers in Plenary 4. Niamh is going to stay with us on stage, and I'm going to ask our next host to come and join us. This is the part where we hand over the baton and tell you about the next places we're going to be visiting. But first of all, before we go into that, I want to just give you a quick reminder of some of the celebrations we had last night at the conference dinner, which I must say was our best conference dinner so far. We have a new award this year, a Lifetime Achievement Award, and we wanted to give it to someone that has been a figure in IFIC's history from this region and has done much to support the work of IFIC, as well as fighting for integrated care here in your country. So that award was given to Rita Ritter, who I hope you all know and are familiar with. And then we also had our usual awards, so I won't go through them all. We do talk a lot about the use of language and, being careful and understanding the power in words. So we do have our Patient and Caregiver Partners Award, but we're always open to new suggestions on what that should be about. But the spirit of that award is around the active participation and involvement of patients, citizens, communities, but also in particular to those that can demonstrate leadership. And the winner actually of our overall integrated care award was written by a patient this year. So a big round of applause for all of those. So before I hand over to Niamh to give some closing comments and we move on to the passing the baton, I just have to say a few thank yous. It's really important. And first of all, I'd like to thank my own team at IFIC. You all play very unique parts in the organisation of this very large and complex conference. You're a great support to me, and I'm always reassured that you're going to do an excellent job. I can count on you every time. And it's been commented to me all this week about what a well-functioning and friendly team that we have, and that's definitely true, and it's in no small part to the demonstrable leadership of Dr. Niamh Lennox-Chigani, so thank you. But I want to pay a particular mention to my colleague and friend, very close friend, Miriam Galvin, who for the past 8 years has been managing all our conferences and webinars and supporting literally thousands of speakers, poster presenters, chairpersons, hub leads, special interest groups, and is quietly beavering away and responding to all your requests. And really, she's the backbone of everything we do at IFIC around our conferences, and everything is no problem and always has a can-do attitude. So thank you, Miriam. Of course, I want to say thank you to our professional conference organisers, Abby. Once again, you've delivered an exceptional experience to us at IFIC, as you always do. You're always obliging, always willing to find solutions, and manage to do it all with kindness and great enthusiasm. So thank you for staying positive, and particularly a big mention to Chrissy Schroeder and all her hard work this year. Thank you so much, Chrissy, and to all the team at Abby. And then too, of course, the Flanders Agency of Health and Care, our co-host. I want to thank you for being genuinely outstanding. You had patience in waiting an extra 2 years as we went through a global pandemic, but still throughout all of that, you've been striving for excellence at every point in the road, and we really do appreciate that. In particular, your engagement across the region, that was evidenced in the huge volume of abstracts we had this year, particularly from the region of Flanders, huge number of patient-written abstracts, and you could see it in the quality of presentations that were throughout the 3 days of the conference. But also you strive to make everything that we do across this event better, and we plan to take that forward with us into future conferences. But in particular, I want to mention Hannah Verhoost, Dietlinde Depra-Bandera, Eileen Maas, Thomas Buck, and particularly our dear friend Solveig Valen. So I think you should stand up and we can all give you a round of applause, please. Please, all the team. Well done. But finally, it's not just the organising committee that makes a conference of this size happen. It really wouldn't be possible without the contributions from our network, and that's from our board, our colleagues at IGIC, our hub partners, our special interest groups, our knowledge partners, and in particular, of a conference of this size, I have to mention the scientific committee led by Jan de Mansenier. What an amazing hero leader of a conference we could possibly have, but also to the army of scientific reviewers that we have, and we know it's a huge task to undertake those reviews, and you know, with 800 abstracts this year, we really needed to rely on you, so thank you. And you can see by the quality of papers that were presented that those have been selected by real experts in integrated care from all over the world. And finally, thank you to you for taking the time to submit those abstracts, to present the papers, to create your posters, and to turn up and attend and share your learning with everybody else. So a big round of applause finally to all of you. So now I'm going to hand over to Niamh, who's just going to try and summarise 170 sessions. Well done. Go, Niamh. There you go.
First of all, no, I'm not. But I will say it has been an absolutely amazing 3 days. Certainly we at the IFIC team are exhausted, but also at the same time energized. There is no doubt that this is more than a conference. This always feels like a celebration. And I had a conversation with somebody on Monday evening, who'd come to our conference for the very first time, and she'd come on her own from quite a long way away, not realizing there were actually a whole group of people from the same place as her that were here that she was able to meet. And what she said to me is, I found my tribe. And I think we've all probably said that at one point or another about coming to these conferences, coming to these celebratory events. And you know, we are hugely positive. We are an optimistic group of people. We wouldn't be doing what we're doing in integrated care if we weren't an optimistic group of people. And I think that has showed over the last 3 days. So I hope that you can see that the plenaries and all the parallel sessions and all the workshops that you've been to over the last 3 days have taken you on that journey and have taken you through some new and creative ideas around how we can really move care into action and really engage for full participation in care integration. And I know that I'm looking forward to continuing that journey. So I just want to see, there should be a couple of slides. I just wanted to share a couple of statistics, because I know some of us do love a statistic. So I'm hoping that, oh, here we go. I forgot the big button. So just to give you an idea of who we've had with us. So Belgium, I've put you in yellow. And we know a lot of this is Flanders. So not surprisingly, our biggest group of participants, but closely followed by the Netherlands and Canada, as ever, big cheerleading for Canada, and the UK and Ireland. So lots of really good representation. And we want to get more and more from those countries, but we also want to be seeing more people coming from lower income countries. This is just face-to-face, so we have a huge number of people that contributed to the virtual program from other countries, so I don't have that data to hand. What I did want to share with you was also, because we've been sending you alerts, probably been maybe slightly annoying, through the app about contributing to our survey. Well, we've got quite a lot of additional ones, and look where Belgium has moved up, really up the ranking in terms of our annual survey, so well done, Belgium. And we look forward to getting more. So that's going to close in another week, so you have a week to fill in your responses to our survey. The other thing I just wanted to let you all know that we've got our international summer schools on integrated care starting again after a pandemic pause for 3 years. We're now starting again in Oxford, and those of you that have done it know that it's a really intensive 5-day residential in Oxford, where you're immersed in all things integrated care with an international faculty. And we've added to that this year with a 3-day residential course on evaluation. And again, the registration for that's going to close in another 2 weeks. So if you're interested, we try to keep those groups small so that you can be really focused in the discussion and have a really rich discussion with a small group of other people involved in integrated care internationally. And I would just like to say my final thank you to 2 particular groups, one of which is our board. The IFIC board is hugely supportive to the work that the team does, and hugely supportive to the broader network internationally. And I'd like to acknowledge all the work that they do throughout the year voluntarily for us as an organisation, and for me personally, keeping my spirits up when times are tough, and anybody who manages a not-for-profit knows what that's like. And finally, I'd like to thank my team, who really do an incredible job all year round, not just for these 3 days that you all get to be part of, but for all of the other days of the year. Thank you to all of you. And with that, I hand back to Fiona.
And so, to Sydney, again. So I'm delighted to be joined here by John Eastwood, by Gabrielle Uribe, and for Zoe Trifandafilidis, and I hope that I pronounced that correctly. Just to say that we're some way along the journey for the 3rd Asia Pacific Conference, so you're going to hear a little bit more about that, and I hope you will be joining us.
G'day and welcome. Welcome to Australia later in the year. I'm Professor John Eastwood, and I'd like to briefly introduce the conference that we're going to be holding later in the year. Oh, what happened to the... Oh, there they are. So the conference theme is to create a truly sustainable and resilient health and care systems that address health inequalities. A transformation is actually needed, a new focus on disadvantaged communities, and an equitable approach to the design and delivery of health and care systems.
The conference will have 5 themes, the first being intersectoral and multi-sectoral approaches to integrating care, developing primary and community-based care, advancing virtual and digital solutions, supporting the health and care of our workforce, and learning from First Peoples, First Nations and Indigenous peoples.
So we have a couple of different ways to present and to submit abstracts. So the abstracts is open and it will close in on the 27th of June, and we encourage non-research individuals and staff wanting to send us your story, your project, so it doesn't really have to be a researcher. So we would like to welcome you, everybody. And this is Sydney. I encourage you to come. Sydney is a very nice city with a lot of things to do. You can replace your bag for some swimmers, and I'm sure you're going to have a wonderful time. There's so many places to see apart from participating in the conference. You got the Opera House, the beaches all over. You will love it. So we'll welcome you there. Thank you.
My name's Nick Goodwin, and I was the co-founder of the International Foundation for Integrated Care, and I'm now working in Australia as director of the Central Coast Research Institute for Integrated Care. It's the joint venture between the University of Newcastle and the Central Coast Local Health District. Our mission is to support research, and particularly research translation, to adopt new models of integrated care to the benefit of the people of the Central Coast and beyond, as well as to stimulate innovations in things like digital health to support older people to live healthy and well in the home environment. So the conference that we have and that we're supporting this year in Sydney in November is a significant opportunity for academics and professionals, health service managers and others to come together to share their innovations, share their research, to create new partnerships and maybe reforge ones that have kind of dropped off during the COVID and come to meet again. So we look forward to welcoming you all to Sydney in November.
Like our colleagues across the country and indeed around the world, we are experiencing a number of challenges. Many of the patients we care for are impacted by the social determinants of health. Often, those who most need integrated care have experienced significant trauma, encountered barriers to accessing care, and need support from multiple services and agencies. For many, their complex needs may affect their ability to engage with our health system, which has become increasingly hyper-specialised. We aim to deliver culturally sensitive and trauma-informed care, and this takes time, careful consideration and adequate funding. This conference is an opportunity to share ideas about innovative and sustainable ways to work. It allows for international collaboration and discussion, which can only lead to better models of care. It helps to foster relationships with low and middle income countries that are experiencing different challenges than the ones we face. It's a truly wonderful opportunity for networking and gives us a chance to travel, connecting with our colleagues from other cultures in a city that celebrates diversity in all of its forms. Above all else, a conference like this will contribute to better systems and therefore better care and better outcomes for our patients and our families in our district and around the world.
This conference is really important because we haven't had a conference on a platform to discuss integrated health and social care after COVID. So we are eager and very keen to listen to the different initiatives, including those initiatives that happened during COVID and how the systems and our people responded to those very crucial challenges. What were the advantages and the facilitators of integrated health and social care during COVID, and what were the barriers in COVID-19.
So conferences like this are really about enabling policy learning. So it's very rare for policies to emerge from a vacuum. We all need to be able to learn from each other and understand what has been tried elsewhere, what has been integrated elsewhere, and what are the different contexts where health system reform and change actually succeeds and thrives. So this is all about learning across jurisdictions, across states, across countries and across the whole world.
So here in Australia and on the Central Coast, we herald integrated care as some of the future solution, our opportunity to find models and approaches that can bring together all of our care solutions wrapped around patients, and particularly some of the patients with the most complex chronic health conditions and needs. And so we see a huge opportunity. This conference for me brings together the knowledge that the great minds and the practical solutions that we've found, both on the Central Coast, across Australia and hopefully the world, into a great solution for the future. In designing our future models and services, I held great opportunity and hope for the future.
As the chair of the scientific committee for the third Asia Pacific Conference on Integrated Care, we look forward to receiving your abstracts and to welcoming you to Sydney in November for what promises to be the major Asia Pacific event on integrated care this year. I'm lucky enough to have been involved with the Foundation for over 20 years now, and this is the fourth time that we'll be having a major conference on integrated care in Australia, and perhaps the seventh or eighth time that we've done it in the Asia Pacific region with our colleagues in New Zealand and Singapore. It's a fantastic event. It's a great opportunity to share experiences, to share knowledge, to reform partnerships and associations that we have over the years, as well as to develop new ones. So I really look forward to welcoming you all to Sydney in November.
now for any of you beady-eyed people, and I only spotted the mistake as I was standing here on the stage, the Irish map appeared all the way through that video and nobody noticed it until... Well, it's evidence that we are a global community and we are truly an international network. And if we made a mistake with your country flags this week, it was on purpose. It was to show that we're one global community. So if Sydney is a little bit too far, don't worry, our next European conference is just around the corner, and I'm very happy to say it's very close to my own home. So we're very much looking forward to working on it, and I'm delighted to introduce Martina Moore from the Department of Health in Northern Ireland. Welcome.
Thank you, everybody. I'm delighted to be here, and can I just start again by thanking the Flanders Agency for Health and Care and IFIC for what's been a really, really enjoyable and inspirational few days. I was thinking about it this morning, about the conference, and I think for me one of the main takeaways has been the sheer talent, enthusiasm and passion, I think, for integrated care. And that really does give you a sense of hope, and I think it was mentioned in the last plenary session as well. I think it's really now about how we capture all of that knowledge, how we listen, reflect and learn from each other. And I think in doing that, how we can really move forward and really start to overcome the many, many challenges facing our health and social care systems. So in Northern Ireland, we are on our own journey, our integrated journey, and we've been on it for quite some time. So we have integrated our health and social care systems. And they're integrated structurally, they're integrated in legislation, but I think it's fair to say in practice we're not as integrated as we should be. And like so many of you, we are facing considerable financial challenges. Our waiting lists are unacceptable, and our recent census figures shows that our population's health and well-being is not where it should, or indeed where we would want it to be. But as I said, we are on a journey. We have excellent examples of integration, of innovation, of true partnership working. We're developing new models of care as part of our transformation journey. And later this year, we're actually rolling out our Encompass programme. So that's going to deliver a single digital care record for all of our citizens across the region. But I think for us, it has to go beyond examples. So if we're really to truly make the change that we need to, we have to integrate at every level. It has to become the norm, or as we would say in Northern Ireland, how things are done around here. So our focus in Northern Ireland recently has been not just on how we deliver health and care, but how we plan our health and care services. So for the last 2 years, we've been developing a new integrated model called ICSNI, and that's really a model for planning health and social care. It's based on collaboration, it's based on partnership, and it really does recognise that many of the solutions to the problems we face lie beyond our traditional boundaries. So as part of our model, we are now establishing new partnership boards, and we hope to have them established next year. And those partnership boards really bring together not just health and social care, so not just primary, secondary and community care, but actually our voluntary community sectors, our service user and carers. And in Northern Ireland, we have community planning partnerships. So they're facilitated by local government, but they bring a gateway towards housing and education. So we're bringing all of those partners around the table and really in that space empowering them towards local planning. So really looking at what are the services that we need in local areas based on local need. So our approach is the population health approach, which has been a key focus throughout the conference over the last couple of days. And I think in the plenary yesterday, one of the presenters said, I think it was, think population, act local. And I think that's something that really does resonate with us moving forward. So as part of that journey for the last couple of years, a lot of what we've been doing has been reflecting on what's happened in Northern Ireland in our integration journey, on our past, what has and what hasn't worked. And that's been really, really important in making sure that in developing this new model, we're giving it the best possible chance to deliver what we need. And that's what we're all looking for here today. Improved health and well-being outcomes for our population and reduced health inequalities. And that reflection must and has gone beyond Northern Ireland. And it kind of goes back to what I was saying at the start about this room, about the talent, the expertise that there is in this room, and actually how we use that to harness that knowledge and that potential moving forward, and why conferences like this are so, so important. So I'm delighted to be here this afternoon to invite you all to Belfast for the 24th annual conference in April next year. Again, that unique opportunity to all come together to hear more about your innovations, your ways of working. A lot of the conversations and the sessions I were in they're work in progress, so it would be really, really great to hear more from them next year to see how they've progressed, but also then to give us the opportunity to showcase to all of you our integration journey within Northern Ireland, and also to showcase, if I'm not being biased, our beautiful scenery and our vibrant city. So what I would say is visit Sydney, but then please, please do come to Belfast. I think, do I need to push a button? Do I need to do it? Yeah.
And that's it. So 2 beautiful countries and cities to visit, and if anybody was in any of our previous Australia conferences or our New Zealand ones, you know you're in for a good time, but if anybody was in Dublin or Edinburgh, expect what happened in both those cities to be tenfold in Belfast. So we'll have a great time. So that's it. I can give you a little heads up that we are already booked for our next 2 years in Europe. So we will be traveling to Lisbon after Belfast, and then we also have confirmed Birmingham for the year after that. So, and not only that, I can probably tell you that it's not going to be very long before we'll be heading back over to our friends in Canada who didn't get a chance to have the face-to-face person conference in 2021. So lots happening, but always willing to talk to you about bringing a conference to your region, so just get in touch anytime. Thank you again. Thanks to all, and safe home.